I'm joined by Jeff Flaks, the CEO of Hartford HealthCare, and as we near the end of a pivotal week and wonder what comes next as we approach reopening, we want to figure this out. So, Jeff, I know a lot of people are anxious to get back to normal, but you say differently.
I do, Kara. First of all, there's so many aspects of our lives we do want to go back to normal. But at the other side, when we think about healthcare, we've learned so many things during this crisis in healthcare. I want us to be better than normal. There are things that we will do going forward relative to health equity, ways that we can do a much more effective job of treating people with disparities, treating people who are most vulnerable within our communities with better prevention, health, and access to services. There's things we're doing relative to telehealth and creating much more access, really 24 hours a day, 7 days a week, that attach people to their providers, through the phone or through the video, which I think has proven to be really effective. We've done more than 70,000 telehealth and video visits. And I look at the way our patients are connecting with their families now and caring for people and the type of engagement we have. So there's many, many things that are going to make us better than ever when we emerge from this.
It's also National Nurses Week, and I know there was a surprise performance. Hopefully you saw it on TV of The Voice winner Javier Colon was there. I saw nurses dancing. This is such a tough time for them. They're really helping people die alone. What was it like to give those surprises to them?
Kara, we had a great moment in Hartford yesterday. Governor Ned Lamont joined us, Lieutenant Governor Susan Bysiewicz. I was in awe of the spirit, the esprit de corps of our nurses. To have an opportunity to bring out 600 some odd people who were able to join us properly socially distanced across our campus and participate in this concert that Javier Colon put on for our people. There was such raw emotion, and you could see it was helping people both find enjoyment and find this moment of celebration, and at the same moment emote to what they're seeing and experiencing in the building. So it was really a wonderfully inspiring moment for us, and I was so pleased. Our nurses and everyone who works in healthcare today, and every person who's working within our buildings today, the work they're doing is absolutely extraordinary, and I just stand in awe of them.
Absolutely, we all are. And finally, I do want to ask you where we stand on testing as people start going back to work. How important is testing, and what's your word for the people wondering if they should get tested?
So as we bring Connecticut back to work, and that's happening over the next number of weeks, and it graduates over time, testing's essential. And I'm so pleased, I'm so proud. We now have 10 testing centers that are up or will be up within the next 2 to 3 days, operating across the entire state of Connecticut. Testing is now much more accessible. So for people who need tests, they don't need a physician order. We have a simplified registration process. We're creating appointments. We're also doing testing, viral testing, as well as additional testing through our Go Health urgent care centers. So I'm very pleased now that we're creating more access. It becomes essential to give people confidence who might be asymptomatic and don't know that they have COVID-19, or to help people who are having symptoms confirm that they have it and properly socially isolate.
So for people who, I get asked that all the time, can I get a test if I want one? Can anyone get tested now?
Yes. The simple answer is yes. And I'm really pleased to say that we have significantly more tests available. The turnaround times are considerably better, so testing is available.
Thank you, Jeff Flaks from Hartford HealthCare.
Thank you.
We wish you well. Thanks for being here.
Thank you, Kara.